right this very moment. Something subtle could be unfolding inside your brain, and you might not recognize it until the damage has already begun. That's the frightening reality of a stroke. It doesn't always strike like a dramatic bolt of lightning. Often, it starts quietly, gradually, silently, interrupting blood flow while a person is still awake, still speaking, still believing the sensation will pass. Maybe you clicked on this video out of curiosity, maybe concern, maybe because a small voice in your mind wondered, what if this ever happens to me? That question matters more than most people realize, especially after 60, when stroke risk rises sharply. Here's the truth. Few seniors are clearly told during the first minutes of a stroke. Your brain is already struggling for oxygen. Brain cells begin to suffer almost immediately. Every passing second influences how much tissue survives and how much is permanently lost. Yet most people freeze in those critical moments, not because they're incapable, but because they simply don't know what to do. Let's be absolutely clear. Nothing replaces calling emergency services. There is no trick, no breathing exercise, no position that can stop a stroke. Medical treatment is essential. But science shows that what you do in the short window before help arrives can affect how severe the outcome becomes. Researchers studying early stroke response have identified several immediate actions that may help support circulation, oxygen delivery, and brain stability. These actions are not cures. They are supportive measures, small decisions that can help create better conditions for your brain until professionals take over. In this video, we'll walk through 5 critical actions every senior should know, ranked from least impactful to most important. Stay with me all the way to the end, because the number 2 action connects to a surprisingly simple technique researchers found can influence early stage outcomes. If you're watching right now, I'd love to know. How old are you, and where are you tuning in from? Leave it in the comments. We read everyone, and your response might encourage someone else to take their brain health more seriously. Now, let's begin. Number 5, loosen tight clothing around the neck and chest. This step is quick, simple, and often overlooked. The moment stroke symptoms appear, whether in yourself or someone near you, remove anything that creates pressure around the neck or chest. That includes tight collars, neckties, scarves, restrictive necklaces, or snug garments that limit breathing. Why does this matter? 2 major arteries run along each side of your neck, delivering the majority of blood to your brain. During a stroke, blood flow is already compromised. Even minor external pressure can further reduce circulation at exactly the wrong time. Unbutton the top of a shirt. Remove a tie completely. Loosen a scarf. Unclasped necklaces. If clothing feels tight across the chest, loosen it. The brain needs oxygen, and efficient breathing becomes critical. You should also ease tight belts or waistbands. Restriction around the abdomen can influence blood return to the heart, and the heart must pump as effectively as possible. This action takes less than 30 seconds, yet those seconds may protect precious oxygen delivery. Number 4, begin controlled breathing immediately. When something feels wrong, panic is natural, but panic triggers rapid, shallow breathing, the opposite of what your brain needs. Controlled breathing helps stabilize oxygen levels and calms the body's stress response. One widely recommended method is the 4-7-8 breathing pattern. Inhale slowly through your nose for 4 seconds. Hold gently for 7 seconds. Exhale slowly through your mouth for 8 seconds. Repeat continuously. Slow exhalation activates the body's calming system, which can reduce stress-driven tightening of blood vessels. Breath holding allows more oxygen exchange. Together, these effects may help maintain better oxygen saturation. If assisting someone else, breathe with them. Stroke can make verbal instructions hard to process, but people often mirror visible actions. Practicing this technique regularly, when healthy, helps it feel automatic under stress. Number 3, note the exact time symptoms began. This may sound administrative, but it is medically crucial. Certain stroke treatments depend entirely on timing. Doctors must know when symptoms started. Without that information, life-saving options may be delayed or ruled out the instant you notice warning signs: facial drooping, arm weakness, slurred speech, sudden confusion. Look at a clock or phone and say the time out loud. It is 3:12 p.m. Symptoms started now. Speaking aloud reinforces memory and alerts anyone nearby. If alone, write it down or send a text. When paramedics arrive, this timing detail should be the first thing you share. Minutes matter. Number 2, position the body correctly. Body position influences how blood moves inside the skull. For many stroke situations, lying flat can help support blood flow toward the brain. If possible, lie down on your back. Avoid pillows. Slightly elevate the legs. However, safety comes first. If there is nausea, vomiting, or breathing difficulty, use the recovery position, lying on the side to protect the airway. Emergency teams would always prefer finding you safely on the floor rather than upright and injured from a fall. What comes next is the most important action, one that involves stillness, muscle relaxation, and a precise 3-minute focus period. Number 1, the 3-minute stillness and relaxation technique. Now we arrive at the action that may have the greatest influence during those first fragile minutes. When stroke symptoms begin, the body's instinct is to react, to tense, to move, to panic, to fight the sensation. But inside the skull, something dangerous can be building: rising pressure. During many strokes, affected brain tissue begins to swell. This swelling increases pressure within the confined space of the skull. As pressure rises, blood vessels can become compressed, reducing circulation not only to damaged areas but also to nearby healthy tissue. It becomes a cascade, reduced flow, leading to more stress, more swelling, more injury. This is where stillness and deliberate relaxation play a powerful supportive role. The goal is simple: reduce unnecessary muscular tension and allow optimal blood drainage from the brain. When fear strikes, people clench their jaws, tighten their necks, hunch their shoulders, and hold their breath without realizing it. These reactions can subtly restrict venous blood flow leaving the skull. Less drainage means pressure may climb higher. The 3-minute technique works by reversing that stress response. How to perform the technique: lie flat, settle onto your back if breathing feels comfortable. No pillows. Let your spine rest naturally. Unclench the jaw. Allow your teeth to separate slightly. Let the mouth soften. No pressure. Relax the tongue. Let it rest loosely instead of pressing against the roof of the mouth or teeth. Soften the face. Release the forehead, the eyes, the cheeks. Let the muscles go slack. Drop the shoulders. Imagine them melting downward, heavy and loose. Release the neck. No stiffness, no effort to hold the head. Breathe slowly. Gentle, controlled breaths. Steady, unforced. Then, remain completely still for a full 3 minutes. No checking symptoms. No sitting up. No pacing. No phone scrolling. Just stillness and relaxation. Why stillness matters. Agitation increases metabolic demand. Movement raises heart rate. Stress hormones surge. Muscles tighten further. All of this can worsen the imbalance between what the brain needs and what it is receiving. Stillness helps conserve energy. Relaxation helps prevent additional pressure from muscular constriction. Slow breathing supports oxygen delivery. Together, these elements create a more stable internal environment while emergency care is on the way. The psychological challenge. This step is deceptively difficult. Your mind may scream, "Something is wrong. I need to move. I need to check if it's getting worse." That urge is driven by fear, not by what your brain physiologically needs in that instant. Focusing entirely on relaxing each muscle gives your mind a task. It interrupts panic. It reduces stress-driven tension. It can transform chaos into controlled response. Why 3 minutes? Research into early stroke stabilization observed that shorter periods often produced inconsistent effects, while longer durations showed no clear additional benefit. 3 minutes became the practical target, long enough to allow meaningful relaxation, short enough to remain achievable under stress. Putting it all together, let's quickly revisit the full sequence. Number 5. Loosen tight clothing. Remove restrictions, improve breathing and circulation. Number 4. Controlled breathing. Stabilized oxygen. Calm the stress response. Number 3. Note the exact time. Protect access to time-sensitive treatments. Number 2. Correct body positioning. Support blood flow while prioritizing airway safety. Number 1. 3-minute stillness and relaxation. Reduce tension. Help manage internal pressure. Conserve energy. Recognizing stroke early and acting without hesitation. Understanding what to do is powerful, but recognizing when to act is even more critical. Because the earlier a stroke is identified, the greater the chance of protecting brain tissue, preserving independence, and reducing long-term disability. Many people imagine a stroke as a dramatic collapse. In reality, symptoms often begin subtly, quiet changes that can be misread, dismissed, or explained away. Let's sharpen your awareness. The fast warning signs. Medical professionals use a simple memory tool called FAST. F. Face. Does one side of the face droop? Ask the person to smile. An uneven smile is a red flag. Arms. Is there weakness or numbness in one arm? Ask them to raise both arms. Does one drift downward? Ask speech. Is speech slurred, strange, or difficult? Ask them to repeat a simple sentence. T. Time. If you observe any of these signs, time is critical. Call emergency services immediately. These 3 checks take less than 10 seconds. Yet they are among the most reliable early indicators of stroke. Less obvious symptoms seniors must not ignore. Not every stroke presents with classic signs. Especially in older adults, symptoms may appear as sudden dizziness or loss of balance, confusion or trouble understanding words, blurred or double vision, a severe, unusual headache, numbness on one side of the body, difficulty walking, a feeling that something isn't right. The key word is sudden. Stroke symptoms typically emerge quickly, not gradually over days. If a change feels abrupt and unusual, treat it seriously. The most dangerous mistake, waiting to see if it passes. This is one of the most common and most damaging decisions. People think, maybe it's fatigue. Maybe my blood sugar is low. Maybe I just stood up too fast. Minutes slip away. Brain cells continue to suffer. Even if symptoms seem mild, temporary, or fluctuating, they may still represent a stroke or a transient ischemic attack, often called a mini-stroke. ATI is a medical emergency and a major predictor of a future, more severe stroke. Never wait it out! Why speed matters so much? Stroke treatment is a race against time. In many ischemic strokes, doctors can use clot-dissolving medications or mechanical procedures to restore blood flow. But these treatments operate within strict time windows. Earlier arrival means more options, lower risk, and better recovery potential. Delays reduce possibilities. What to say when calling emergency services? Clarity helps responders prioritize. Speak calmly and directly. I think I'm having a stroke, or someone here has stroke symptoms. Provide your exact location, symptom onset time, and main symptoms observed. Do not minimize. Do not speculate. If you are alone when symptoms begin, this scenario is a major fear for many seniors. If you suspect a stroke, call emergency services immediately, even if unsure or if symptoms feel mild. Unlock the door if possible. This allows faster entry for responders. Sit or lie down safely to reduce fall risk. Begin supportive actions like loosening clothing, and controlled breathing. Stay on the line if instructed. Never attempt to drive yourself after help has been called. Stay focused. Once emergency care is on the way, do not eat or drink. Do not take unapproved medications. Do not attempt strenuous movement. Focus on stability, breathing, and remaining calm. Building stroke readiness into daily life. Preparation reduces panic. Keep your phone within reach. Learn emergency numbers by memory. Share medical conditions with family and practice calm breathing. Small habits create powerful safety nets. Lifestyle factors that influence stroke risk prevention remains essential. Major contributors include high blood pressure, diabetes, smoking, sedentary lifestyle, poor sleep, uncontrolled cholesterol, and chronic stress. Regular checkups and balanced nutrition significantly reduce risk. A gentle but honest reminder. Stroke is common and serious, but not always catastrophic when treated rapidly. Modern medicine has dramatically improved survival, yet those benefits depend heavily on how quickly action is taken. Your role matters. Knowledge, recognition, speed, and calm action. These decisions made in living rooms and kitchens can protect a lifetime of memories. If this information helped you, share it with someone over 60, save it, and practice the breathing technique. Preparation changes outcomes. A message for viewers over 60. This isn't abstract. Risk increases with age. But you are not powerless. You can recognize symptoms, call for help, and support your body intelligently. A message for family members. Share this with your loved ones. Very few conversations address what to do in the minutes before help arrives, yet those minutes are often decisive. Final thought. No technique replaces medical care. No delay is acceptable. Emergency services must always be contacted immediately. Calm, informed action during the waiting window can create the best conditions for the brain. And sometimes, that difference is life.